Hello and welcome to Perspectives. I'm your host, Williamson. On last week, we began a series on HIV/AIDS, a very sensitive subject. We talked to Dr. Harold Kapner, who's a specialist in HIV/AIDS treatment, and we got some really good information about the causes, the treatment, and new therapy that may be on the horizon for HIV/AIDS. On this week, we're going to talk with a 20-year HIV/AIDS survivor, Vanetta Ferguson. You do not want to miss her very inspiring story. Stay with us. We'll be right back. Welcome back to Perspectives. If you're just joining us, we're talking about HIV/AIDS on today. I'm joined now with the 20-plus year survivor, Ms. Vanetta Ferguson. We want to welcome her to the show.
Thank you.
Vanetta, just candidly tell us your story.
Okay, I'm from New York, I'm not from Macon, and in 1986, I got engaged. I was in a relationship with a young man that was an ex-IV drug user. Mm-hmm. And we lived together, and he got very sick around the end of the year, around 86, 87. And he moved on back home with his parents because he was deathly ill. I didn't know at the time that he had AIDS. Mm-hmm. I don't know to this day did he know he had AIDS. Mm-hmm. But I know when he went into the hospital that no one told me anything and that they quarantined him. Mm-hmm. He died about a year later, and then it was rumors said that he had full-blown AIDS. I saw a lot of changes in him, in his body and stuff, so, you know, I believed it, but I didn't think I was sick. You know, I wasn't at risk, so for some reason, I guess I was in denial. I didn't know anything about AIDS, so around 1990, I went and got tested with a girlfriend. You know, we did the buddy system. Let's go get tested just for the heck of it.
So that was 4 years. 3 or 4 years later.
Yes, yes, yes. And I tested positive. They called me to come back into the doctor's office. At that time, I would not go. I just went into a deep denial. And then I moved down south, and I just kept going and kept having symptoms. I had a primary care doctor I was seeing, and I was constantly in the doctor's office, you know. I thought I wasn't at risk because I wasn't a drug dealer. I wasn't, you know, promiscuous, a prostitute or anything out there. So I didn't, you know, think I could catch it or had it. Right. And then I started getting sick of problems with breathing, female problems, very tired all the time. And so I got sick one day and I couldn't breathe. And they rushed me to the hospital, to the doctor office first. And he put me in the hospital. I had pneumonia. And I had lost a lot of weight. I was 90-something pounds. He told me they were going to do an AIDS test. He said, all the symptoms you've been having, he said, I suspect you have AIDS. So they did the test. I went home after a week, and I got a call the next day from the doctor's office telling me to come back. Now, when I went home, no one said anything to me about the test results, so I'm thinking that,
you're okay.
Yeah, I'm fine, you know. And I went back to the doctors. They told me to say, come to the doctor, bring someone with you. And I was like, oh, you know, I was scared then. I was petrified. I was really scared. I brought on a pastor at the time, Reverend Brown's wife came with me, and another woman from the church came with me. And they literally had to carry me. When I went back to the office to speak to the doctor, they wouldn't let them come with me. So he said, I'm sorry to tell you, but you tested HIV, you have AIDS. I don't know anything about AIDS. I don't know much about it, but you have it. And
this
I'm
is
like,
what the doctor told you?
This is what the doctor told me,
wow.
General practitioner at the time. That was in '94. So now, you know, the virus can lay dormant, you know, up to 10 years and stuff. So I was like, are you sure? Did you test? Can you test me again? And he assured me that they did multiple tests. And he said, I don't know how long you have to live. He said, I really don't. Now, at that time in 1994, right here in Macon, there were a lot of people dying from AIDS. The people that were infected that I knew of that were dying from AIDS. At that time, they only had one medicine, AZT, really the main medicine. So he gave me a bottle of sleeping pills and tranquilizers and sent me on my way and told me to register with the health department here and get some care, some information. So I was devastated. You know, I was crying. I had 2 children. I was divorced, and I'm like, I want to see my children graduate high school and college. And, you know, I thought I was going to die. I really thought I was going to die. And I said, I don't want to die. So I did some information and found out there was a center called the Rainbow Center, which did AIDS education and had support groups.
Is that here in Macon? Here
in Macon, and they were downtown on 1st Street. And so I got in touch with Johnny Fambro, who most of you know is the ASO for AIDS, anything services here. And I talked to them, and they assured me that, you know, if I took care of myself, that I could probably live. They didn't know how long I could live. And so, you know, start on my medications and things. My problem is that I'm resistant to a lot of medications. Right. I was resistant and had a hard time with the side effects. Dr. Katner started me on AZT, and I took the drugs. You know, it made me sick and everything, you know. And a lot of my friends were taking the drugs. A lot of them were in the end stages of AIDS. When I found out when I tested positive, I was actually full-blown AIDS. My T cells were only 120, and they had got down to even 60 T cells.
So there, from the inception, you initially had shortness of breath. So there was no flu-like symptom stage for you?
No, I did get the flu back in '86. See, I did get the flu before my boyfriend got sick. I did get the flu because I stayed out of work a whole week, and I had exactly classical flu-like symptom. And then I got better. So he died a year later. Nobody knew the flu, you know, that was it.
Right.
So I did get that flu. And so it wasn't until '94 till I got the pneumonia, I really got sick. So we're talking like eight years later, you know.
So before we move forward, what type of side effects or problems did you experience with the AZT? Because if I'm not mistaken, AZT was probably one of the first drugs back in the early '80s that was used to treat HIV/AIDS.
And a lot of people say AZT is what killed a lot of people. I mean, it's not funny, but when you think about it, I mean, that's what they had, and that's what we had to take. And a lot of the people died before they came out with the antiretrovirals in the they called it a cocktail. And it was that year that, oh my goodness, I could be one place one week, and the next week, you see somebody one day, the next day they're gone. Right. You know, they died. And I saw a lot of suffering, a lot of people die right here in Macon, Georgia, of AIDS. Some of them, you know, it was sad because some of the women, a lot of women infected, lots of women, and their families didn't want anything to do with them.
Right. Well, how was your support network?
Well, my support was strange because I have a brother that was also HIV positive. He was a recovering addict. He since died 2 years ago. But when I told my parents, you know, the first thing I thought, well, how come he doesn't have it, you know, because it's his lifestyle. Right. You know? But he didn't, you know, for a while. And my family supported me, but they thought I was going to die. So all of them came down from New York to say goodbye to me, to visit me. And it was strange at first because they all thought I was going to die. You know, they really thought they were seeing me for the last time, and they saw how I had lost all the weight and my skin was drawn and sunken in, and I was, you know, having problems breathing and getting oxygen, and I was probably on my way out. So maybe the AZT did help some. But I was I came in right at that time they started the antiretrovirals. And right before then, I was losing a lot of people, a lot of friends that year. Right.
Well, in your experience, did you, I know you say you lost some friends to HIV/AIDS, but did you lose friends when they found out that you were diagnosed? Friends who might have been afraid. I know I talked with Dr. Katner about the idea of not using the same spoon, not using the same cup. I can't even touch you. I can't give you a hug.
Oh, yes.
What was your experience with that?
Still do. Still have people that won't hug me and won't touch me. Oh, yes. My family came down, and they didn't stay with me. They stayed with other relatives that I had here at the time who have since passed on. You know, it was ironic. But
were they afraid to stay with you, or they just
yes,
chose?
My parents wouldn't even, my mother wouldn't even, they wouldn't even use my bathroom. But they loved me,
Right.
but they were just scared, you
Right.
know. And they wouldn't even use my bathroom.
Wow.
And so a lot of people, I decided, you know, once I started getting medication and going to support groups, that I need to educate people, especially black women, you know, with getting this disease. And, you know, I had a lot of gay friends that had the disease too. But you know what? They at that time, they had their own support system.
Right.
Where we didn't have it, you know, and they were really, you know, being careful, and they really had a good, strong support system because, you know, it was known as a gay disease,
right.
which is not and never was. And but we didn't have any support.
Right.
And a lot of times people were ashamed to talk about it. You know, I've been in the hospital with women when they were dying, you know, that had no family there. And the family just was so ashamed of them because maybe they were on drugs at a time and their risky behavior, you know, caused them to get AIDS. Some of them, you know, were prostituting. And it was very, very sad. And these are young women.
Yeah. So what was the turning point for you as far as, I know you said you lost a lot of weight, under 100 pounds or so.
Oh, yes.
And is it the medications? They changed the medications for you. You look healthy as a...
Right now, as the last time I tested, I'm undetectable, which is great.
Yeah.
My T cells have went from a 60 to like I told you, 60 to 125 when I was first diagnosed, to 700.
That's great.
That's great.
That's great.
But
you're still on medications now,
I'm
am I
on
correct?
medication, and it's only because of that medication. I still get sick. I still am weak every day from the side effects of the medication. And my T cells fluctuate so often because now, you heard Dr. Katner say if you take your medicine every day, that's twice a day. I'm taking like 16 pills.
Oh, wow.
Yes, and there are times that I miss because either I forget or I have something to do. Because if I take the medicine in 20 to 30 minutes, I'm out. I'm out of it. I'm knocked out. I'm really tired
16
and
pills
sleepy.
twice a day?
Yes.
Every day?
Every day.
And how long have you been doing that?
Oof. Since I got on medicine in 1994. You know, since I met, and that's when Dr. Katner became my doctor. I didn't have a doctor when I was up north because I didn't go get treated. You know, I was in denial. But it's times during the year that my T cells will drop and that won't be undetectable. I've been undetectable for this year. Last year I wasn't undetectable. I was detectable. So when he finds that out, they do blood work every 3 months. Then he tries to, you know, either find out what the problem is, and most of the time it's me, you know, just not adhering to my medicine, which is something that's very hard to do, to have to take medication twice a day, every day, and not miss. It just, you know, your lifestyle, you can't do anything.
Are you overwhelmed with vitamins? Do you have so many supplements that you have actually forgotten why you take some of them? Are you not getting the results you want from your new supplement program? Hi. At Scott's Pharmacy, we are extensively trained in vitamins, minerals, and herbal products. We are also experts at medications, various disease states, and drug-nutrient interactions. So no matter what your issues, blood pressure, diabetes to hair loss, we can help. Stop by Scott's Pharmacy for a consultation and start looking better, feeling better, and being better.
Furnished 123 is a new way to shop and buy furniture. Did you know that for only $3.99 you can get a sofa, dining set, or bedroom set? Reclining sofas are only $5.99 and sectionals just $7.99.
Any pair of lamps, a 5x7 rug, or accessory pack for $99. A 3-piece table set for only $1.99. Queen mattress sets for only $2.99.
It's that simple. Furnished 123. Furniture buying as easy as 123.
Now open inside Mobley Furniture Outlet, Perry.
Now, I can imagine having that amount of medication to take each day or each month has to be financially taxing.
Yes.
Or how are you dealing with that?
Well,
Is that something that insurance covers?
Fortunately for me, I had to stop working in '94, and I was a cook, and I had to stop working because they knew I could no longer do that type of work. And I got on disability. So fortunate for me, I'm one of the fortunate ones. I do have Medicare and Medicaid to pay for my medication. And there are people that don't have any, and they have grants from the state, Ryan White grants, and they have a system to pay for people's medication that don't have insurance. You know, but like, you know, those funds are getting cut too. You know. So I'm very fortunate with that.
So what's a typical day in the life of Vanetta Ferguson? When you rise in the morning, are you tired? Are you
when I
agitated?
Get up in the morning, I have to eat. I can't take my medicines on an empty stomach. I also have to take a lot of other medicine. One thing about this virus, it can cause, like Dr. Katner said, cause a lot of problems, other health issues. Since I've been taking this medication, I've had problems with high cholesterol. I've had problems with fatty, what they call a fatty liver, you know, and it messes with your liver. That's why they have to check your liver so often. You know, you can get depressed from it, memory loss, basically just really tired and fatigued. And it messes with your body, with the fat, like he said, the lipodystrophy. Okay, and that's what happened with me. I had lost a lot of body mass and weight, hips, and you get this stomach, which, you know, a lot of people have, and you can be slim and thin, and you get a stomach because a lot of the fat deposits there.
And that's all just a side effect of the medication.
Yes.
Yeah.
The back of my neck, I have to have surgery tomorrow. I have a tumor on the back of my neck from cause of the medicine.
From the medications.
Yes, and they call it a buffalo hump, and mine has grown, so they're going to remove it. But yes, you could have wasting. A lot of people you'll see with wasting, they just can't keep the weight on them. So they have to take Ensure. If I stop taking my medication, my weight's going to drop, and you'll look at me and can tell I'm sick. You know, so you have a lot of those problems, female problems. A lot of people that are HIV positive are prone to getting cancer. I've had a cancer scare. And it's something, you know.
Has your diet changed any?
I have to eat better and take care of myself. That's important, your diet. But my support mostly is prayer, you know, having a relationship with God, you know, in my church, in my family, and trying to keep active. And sometimes I can get very active, but, you know, I get all involved in things, and it takes my mind off it. So I don't think about poor me, you know, I don't have that pity party. I just think I'm a normal person. I'm going to go do things. But it catches up with me in the evening, and sometimes it catches up with me, and I have to just rest, you know.
I was just going to ask that, I know you're a very active person in the community, and are activist for HIV/AIDS, actually.
Yes, I'm with an organization called Sisterhood, and Sisterhood was founded in 1994-93, and they started giving support to black women, and saw that a lot of women were, you know, getting infected with AIDS and stuff. And they go out and they do support. We've given out condoms. We do a lot of health fairs now because that's the way to get people in to talk about AIDS, you know. And in the church, I think is the #1, you know, draw that can do more for AIDS as far as support and talk about it and educate people, because people are not getting educated about it. They don't want to hear about it. You know, it's a stigma attached to it because of the way you get it. It's a sexual disease, you know, do sexual contact, and people don't want to admit they're having sex, you know, which is a natural human function. But it's just so taboo in the church, you know, and a lot of men, women have died from it, and they're still dying from it. So there is no cure. People think because, like you said, Magic Johnson, you know, they look at me. I said, yeah, but that's only because I'm sacrificing. I'm taking my medication. Now, if you've seen me 10 years ago, 15 years, if I stop taking this medication, you know, it's like, you know, the Cinderella effect. And
I don't want to get too personal, and just let me know if I am, but are there times when you, the real Vanetta, takes a step back and says, I don't know how much longer I can do this 16 or 32 pills twice a day. I'm active throughout the day. I'm keeping myself busy. I'm keeping my mind involved in these things. But there has to be a time when the music stops and there's a quiet period when you're alone by yourself. Tell me about those times.
Well, that's one of my problems, being active. And Dr. Katner gets on me all the time because when I have something to do, I tend to not take my medication like I should.
Bad you. Bad.
But for me to have any kind of lifestyle, you know, to be able to function, basic necessity function every day. Get up out the bed, feed myself, do errands, clean. You know, it's no way I could do that and take medication twice a day, every day. And there are times that I miss because I forget.
Right.
Okay. But basically, I'm taking medication twice a day, every day. Now, I'll tell you something. If I have something to do, I won't take my medication till after I do it. When I go to church on Sunday morning, I can't take my medication till I come home.
Right.
You know, so I have to take that and then the evening dose, because if I did, I wouldn't be able to make it to church.
Right.
That's how powerful the medications are, and they knock you out. You know, you're tired. I'm still tired all the time. I'm tired now. I have problems with my glands, swollen glands, which I have now. You know, and a lot of pain. I have arthritis and some other things, but you know, like I said, I don't dwell on that. I try to keep active and keep going, and because I know, you know, people see me and say, well, she can do it, you know, she's making it. I want to be, you know, a testimony, hear my testimony, and also to prevent people from getting AIDS, you know, and to help women, and, you know, to let people know that, you know, yes, there's no cure, but if you live right and you take care of yourself, you know, you can live with this disease.
And I think that's the most important things, because I think people, when they hear HIV, it has become such taboo in the community, and they automatically think it's a death sentence. And I think it's important for you being so transparent to let the viewers know that there is life after HIV.
Yes.
What things would you, if you could just give your thoughts or your expression of insight to someone who was just diagnosed HIV/AIDS to try to comfort them, what would that be?
Oh, and I do that. I do it a lot online. We don't really have support system in Macon Church.
And why is that?
Because, for one thing, they have support group for Narcotics Anonymous, Cocaine Anonymous, which a lot of those people are HIV positive. But for the black community, we don't have any support, because people don't, number one, want to admit they have it.
Right.
Number two, they don't want anybody to know that they have it.
And I think that's partly because
Because of the stigma.
Right, the stigma attached to it, and they think they're going to be ostracized, and
yes.
people are going to point the finger when they see you come, oh, there she is, there he is. So I think that keeps a lot of people closeted, so to speak.
That's something we can do something about. But like I said, it has to begin in the church.
Yeah.
Because that's really where you're going to reach the masses, you know. Support, talk, education.
Right.
Education is my thing, educating people about it. We can't even go into the Bibb County schools now and talk about AIDS. You know, because they say we're talking about condoms, we're talking about AIDS, so we're promoting sex. We can't even do that legally here.
Right.
And that's something that needs to change, because as you know, our children are having babies, and they're having sex, and they're getting STDs. And our youngest patient we had that Dr. Catton had was 13 years old. A woman was, a 13-year-old girl was diagnosed in Macon, Georgia with full-blown AIDS.
Wow.
13 years old.
Wow.
And she didn't get it from another 13-year-old child. She got it from a grown man. You know, so that risky behavior.
Yeah. So if you could do anything differently from when you first had your initial symptoms or the flu-like symptoms, if you knew then what it could potentially be or potentially could have been, what would you do differently if you could look back?
If I could look back, first of all, I would have been practicing safe sex.
Right.
You know, even though I was, and the man I got it from, we were engaged. We were living together, planning to get married, so I thought I was safe.
Right.
But you just don't know. You really have to know a person's history, you know, and you're really taking chances if you don't use condoms, you know, and practice safe sex. If you're very promiscuous, having more than one sexual partner and things like that. And you know what, drugs and alcohol play a role in it, because when you're under the influence, you know, you just carefree, you don't care, you don't think.
Right.
You know?
It alters your everything, yeah.
Yes, yes.
Wow.
So that's important. I get a lot of calls now. I do a lot of networking online, and that's a good thing, because I have a lot of support groups online. People come to me online. A woman just got diagnosed in her 30s, had 3 children, is shocked, contacted me just last week, and another state, New Orleans. And she said she doesn't know what to do. She says she's told some of her family, but not all of her family. And she wants to know how long she has to live. So I networked with her. I had a young man in his 20s, very handsome young man, contact me and told me that he found out doing drinking, he had a one-night stand with a young woman, and he found out that woman had AIDS.
Wow.
And he said he comes from a small community, and he was ostracized, and he just was devastated because he had to go get tested. And you know, when they test you, sometimes you have to wait 3 months, come back, get tested again. So he was going crazy. And I was on the phone with him, and he was crying with me, talking about he just know he has it, and what is he going to do? People stop speaking to him. You know, everybody knows he lost his girlfriend, and all because of that risky behavior at one time.
Yeah, it only takes one time.
And come to find out, I told him, you know, that I didn't think he was positive. And now he found out after 6 months of testing that he wasn't positive.
Oh, wow.
So I hoped, you know, and I told him about changing his behavior, you know, and his habits.
Wow. Well, Renetta, we want to thank you for coming out today and being transparent and sharing your story with us and opening up your life to our viewers. We hope that someone's life was touched on today, and that the most important thing we wanted to bring to the audience is that testing is so very important. It's important to get tested and to know your status. Continue to watch us. Continue to tune in every week. Again, you've been watching Perspectives, where you're not only informed but inspired. Listen, if you're a Facebooker or a Twitterer, follow me on Facebook and on Twitter. You feel free to visit my website, perspectivestv.com. We'll see you next week.